Chrissy.
And I'm Jenny.
And we're here to tell you about
Anti-Emetics.
Do you puke out at parties?
Do you have a strong gag reflex?
Are you about to undergo surgery?
How about chemotherapy?
If you answered yes to any of these questions, then we have a product for you.
An antiemetic.
What's an antiemetic, Jenny?
Well, Chrissy, anti means against and emetic means vomiting. I'm against vomiting.
Me too.
An antiemetic is a medication prescribed to help handle nausea and vomiting.
But how is this possible?
Well, antiemetics work on the CTZ.
What's the CTZ?
CTZ is a chemotrigger zone, an area of your brain in the medulla, right here, that triggers your vomiting center.
That's fascinating. But what triggers the CTZ?
Stomach distension,
Your gag reflex,
stretch receptors in your uterus or bladder,
motion sickness,
chemicals or hormones found in our own bodies.
and intense pain. But that's not all.
It's not.
No, after the impulse is transmitted, you will have increased salivation and increased mucus secretions in your GI tract.
And this causes increased swallowing, bronchoconstriction,
Deep respirations, increased heart rate,
and nausea and vomiting. But there is hope.
Antiemetics.
We have not one,
Not two.
but 3 classes of antiemetics to help you. First, we have phenothiazines. They block dopamine in the CTZ.
We then have serotonins. They block serotonin in the GI and the emetic center.
Lastly, we have cannabinoids.
Wait, cannabinoids, that sounds familiar.
It should. It's derived from the active ingredient in marijuana.
Oh, but don't worry, we are not giving you reefer madness.
Look out, Cheech and Chong, the secret's out.
How do you take them?
Well, you can take them through tablets,
Via syrups,
IV, or intramuscular injection.
and they work so fast. In just 5 to 10 minutes, you'll start feeling better.
And they last so long, up to 3 to 12 hours, and they reach their peak effect in less than an hour.
That's fantastic!
It is fantastic.
But can anyone take them?
No, not anyone.
Phenothiazines are not for those with central nervous system depression, brain damage, severe hypo or hypertension, or those with liver or kidney dysfunction.
Also not for anyone with an active peptic ulcer. And you should use caution in lactating or pregnant women.
Serotonins are not for pregnant or lactating women.
And cannabinoids are a class 3 controlled substance, so they're only approved for use in patients with severe nausea associated with chemotherapy. Or cannabinoids can be used to treat nausea and vomiting that has not responded to other treatments.
You should not be driving while you are on cannabinoids.
Wow! It sounds like antiemetics can be super helpful.
So remember, the next time you're struck by nausea, pregnancy, or you're about to undergo surgery or chemotherapy,
Ask your doctor if antiemetics are right for you.
wow, this has been really fun. Thanks, Jenny.
Thanks, Chrissy.
You know what? I think I'm gonna go ride a roller coaster.
I think I'm going to join you.
Bye.
Side effects of antiemetics include sedation, hypotension, tachycardia, ileus constipation, anorexia or weight gain, urinary retention, photosensitivity, blurred vision, tinnitus, increased CNS depression, blood dysplasias, drug-induced hepatitis, headache, dizziness, myalgia, rash. Cannabinoids could produce euphoria, weakness, dry mouth, fatigue, confusion, depression, disorientation, hallucinations, or drowsiness. Call your doctor immediately if you develop muscle rigidity, delirium, or cognitive changes, as these changes could be permanent. Rare but life-threatening side effects can occur, such as neuroleptic, malignant syndrome, and autonomic instability.